Hello everybody, I'm Dr. Raman Kapoor. I am a specialist in medical acupuncture and I've been practicing this science of acupuncture since the last 37 years in New Delhi. I also happen to be heading the Department of Medical Acupuncture at Sir Gangaram Hospital for the last 22 years. Today I wish to discuss and also create an awareness amongst the Delhiites regarding the alarming problem of pollution in the city through which all of us are going through. And leaving the city is not a solution. The solution lies in having different methods to curb the pollution and also, most importantly, to improve the immunity so that we are able to pass through this crisis and prevent ourselves from developing diseases. And in that aspect, acupressure and acupuncture are effective tools. Prevention is better than cure. And as we all know, the major problems which are caused due to pollution are flu, colds, recurrent chest infections, bronchitis, allergic rhinitis, sinusitis, bronchial asthma. These are a few of the common problems which small children as well as adults face. And acupressure is a very effective tool which is useful to enhance the immune system, which is the basic system to help us fight all these infections. Now I would like to go through with you the commonest acupressure points which you can press on your own and get relief. The acupressure points which are very useful for immune enhancements are now going to be shown with the location of those points. The first point which I am showing is the point which is known as kidney 3. This point is located midway between the highest point of the ankle bone and the Achilles tendon. This is the location of that point. Stimulating this point on both the feet alternately, like for example I am stimulating it on this side. Same way we can stimulate this point on the opposite side also. This helps in strengthening the immune system, and it also helps in treating asthma, sore throat, headaches, anxiety, and also regulates the proper functioning of the kidneys. The next point which I am going to show is known as spleen 6. The location of this point is very simple. This point is located about 4 fingers above the ankle bone, along the back side of the tibia bone. This is the exact point which I have marked on the location. And this stimulating this point on both the feet alternatively helps in relieving the immune weakness and restoring vitality. As I am showing to you, this is a way of pressing this acupressure point. On the opposite side also, same way, we have to locate this point, and once we have located the point, we can do acupressure. The next acupressure point which I want to share is known as stomach 36. This point is located 4 finger widths down from the bottom of your kneecap. So I am marking the point, and this is along the outer boundary of the shin bone, and again we do a clockwise rotation on this acupressure point, and at all these points the treatment time is 1 minute. Same way we have to do it on the opposite side. And the point stomach 36, location is very simple, 4 fingers down and along the shin bone. The next point is lung 1. This point is located on the anterior chest wall. It is very simple to locate this point. Just take 8 fingers from the midline on the chest wall and just below the clavicle is an area which is known as lung 2, and in the first intercostal space below that is the lung 1 point. So as I am showing and also locating it, this is the point lung 1, and we can press acupressure here also for 1 minute. Same way we can do acupressure on the same point lung 1 on the opposite side also for 1 minute. The next point is N4. This point is located 4 fingers below the umbilicus, as I have marked it, and this nourishes and tonifies the essence, promotes health and prevents diseases. This also warms and regulates the flow of blood. The next point which I am going to show is called N12. This point is located on the stomach, and it is about 5 fingers above the umbilicus in the midline. And again, this point is we can do acupressure the same way, and this nourishes and tonifies the essence energy of our body also, and it is a tonification point, and it also harmonizes the stomach energy. The next point is N17. This point is located right in the middle of the chest. If we were to draw a line between the 2 nipples, this point is right in the middle, and this is known as N17. It helps to improve our immune system, and also strengthens our immunity. And again, this is a midline point, so it's only 1 point, and this is the way. Again, rotation, and for 1 minute. And this point also helps to release stress and anxiety. The next point which I am now going to show is Li4. This point is located between the thumb and the index finger, and it is at the highest point of this protuberance, which is Li4, and this also has to be stimulated in the same way. And this point is very effective in dispersing the wind, and it is also very useful in the beginning of cold, and it also helps in clearing the lung heat. So patients who have got initial stages of infection, when we stimulate this point, it is also effective in giving immediate relief. The same point can be located on the other side also. So whenever we treat these points, they have to be treated on both sides of the body. The next point is lung 7. Lung 7, the method of location is we just catch both the thumbs to each other with the patient, and where our index finger falls is the acupressure point lung 7. And this point is one of the most powerful points of the respiratory system, and it is effective in all type of respiratory problems like cough, congestion, respiratory distress, wheezing, bronchial asthma, chronic obstructive pulmonary diseases, all these conditions. This is a very, very strong acupressure point. The same point can be located on the other side also, and also has to be given acupressure in the same way as was shown in the right side. So all the points which I have shown now have to be treated for 1 minute each with acupressure, and the total amount of time required will be accordingly 1 minute at each acupressure point, and after that the treatment is complete. Now I am going to share with you another very interesting method of treatment, which is known as Moxibustion. This is also a self-help treatment method in which we use what is known as a smokeless moxa. This is a Chinese herb known as Artemisia vulgaris, and this is used to be heating a specific acupuncture point in the body, which is known as stomach 36. I have already explained this location. I will show it to you. 4 fingers below the kneecap, and 1 finger lateral. At this acupuncture point, we can just give mild heat to the point, and when the patient feels more heat, just withdraw it and come back again. So at each acupuncture point, stomach 36 on the left and the right leg, we do Moxibustion for about 10 minutes each. So a total of 20 minutes Moxibustion is done. This can be done either with the patient himself, or one or any relative or friend of the patient can also do it. And this is such an effective acupuncture point that it is known as a point for 100 diseases, because not only does it build the immunity of the patient, it is also very effective in improving the blood circulation in the legs, and it's also used for many other diseases. Now I am showing to you the treatment which we also do with needles, which is known as acupuncture. This is a needle. This is a very thin hair-like needle. You can see it's a very fine needle, and these needles are inserted at specific acupuncture points in the body, and this is very effective in the treatment of more chronic diseases like allergic disorders, bronchitis, sinusitis, asthma, chronic obstructive airway diseases, and even very difficult conditions like interstitial lung diseases. Now I will just show you. We put this needle in a tube and then just insert it at an acupuncture point, which was lung 7, which I had marked before, and that's it. The needle is already done, and the patient does not even feel any pain. I'm going to share with you another needleless method of therapy which we use in our clinic. It is known as color therapy or color puncture. In this therapy, instead of putting needles, we expose the acupuncture points to different colors, as you can see in the equipment: blue, violet, red, indigo, and depending upon the condition of the patient, we treat those acupuncture points with these colors. So this is a very effective tool of therapy, particularly for children who do not like needles, and also in some patients who are very apprehensive of needles. Now I am going to show to you another needleless method of treatment, which is known as cupping therapy, in which we create vacuum at acupuncture points. So, for example, in patients who have low immunity, we use this at acupressure point UB13, UB23, so these are very effective techniques, and this is known as cupping therapy. And these cups are kept in position for about 10 minutes, after which they can be removed easily. Now I am going to talk to you about two very effective therapeutic methods in acupuncture, which are to be used by the clinician. One is known as catgut embedding therapy, in which a small thread of catgut is embedded at an acupuncture point, which is in the middle of the chest, and this is very effective in the treatment of chronic respiratory diseases like asthma, chronic bronchitis, chronic sinusitis, chronic pulmonary diseases, and even interstitial lung diseases. And another method which is also useful and for patients who have seasonal problems, like a change of season, they have problem of asthma, or they have problems of sneezing, rhinitis, sinusitis. This is known as patch treatment, in which a special type of herb mixture is used when making these patches, and these patches are applied at specific acupuncture points on the back of the body, and these are done on specific dates of the year. Twice in a year these can be done, and at change of season in the summer and at change of season in the winters. And there are two videos which follow now, and you can see both the catgut embedding and the patch treatment being done.
सर्दियों के दिनों में ऐसी तस्वीर आम है और इसी के साथ आम है वो बीमारियां जो ठंड बढ़ते ही कई लोगों के लिए मुसीबत लेकर आती हैं। लेकिन आज हम आपको बताने जा रहे हैं इलाज की ऐसी तकनीक के बारे में जो ठंड के मौसम में होने वाली तमाम परेशानियों और बीमारियों से छुटकारा दिला सकती है। सर्दी, खांसी, जुकाम, अस्थमा और ऐसी ही बीमारियों से कैसे निपटें, जाने माने एक्यूपंक्चर विशेषज्ञ डॉक्टर रमन कपूर से खुद सुनिए।
दिल्ली जो है वो धीरे धीरे पोल्यूशन कैपिटल ऑफ द वर्ल्ड बनता जा रहा है। यहाँ पोल्यूशन बहुत ज़्यादा बढ़ गई है और उस वजह से बीमारियाँ जो रेस्पिरेटरी इलनेसेस बढ़ती जा रही हैं। इन रेस्पिरेटरी इलनेसेस में अगर हम कॉमनली देखें तो छोटे बच्चों को भी इफेक्ट आना शुरू हो गया है। स्कूल गोइंग चिल्ड्रन हैं, कॉलेज गोइंग स्टूडेंट्स हैं। ये इलाज है, ये चाइना में तो बहुत प्रचलित है, इंडिया में हम अभी इसको शुरू कर रहे हैं पहली बार। इसमें एक मॉक्सा एक हर्ब होता है, चाइनीज हर्ब। इसके हर्ब्स के पैचेस बनाए जाते हैं और ये पैचेस जो हैं ये 3 दिन होते हैं कैलेंडर ईयर के, जो स्पेसिफिक डेज हैं। और इस साल में वो 3 दिन जो कैलेंडर ईयर के ल्यूनर ईयर के हिसाब से एस्टेब्लिश किया है चाइनीज जो करते हैं, वो 21 दिसंबर है, 30 दिसंबर है और 8 जनवरी है। तो इन 3 दिन के जो है क्योंकि जो पोर्स होते हैं एक्यूपंक्चर पॉइंट के वो इन 3 दिनों में खुल जाते हैं। सो इन 3 दिनों में स्पेसिफिक एक्यूपंक्चर पॉइंट्स पे ये मॉक्सा पैचेस को लगा दिया जाता है और ये तकरीबन 4 से 6 घंटे तक पेशेंट को लगा के रखने होते हैं और उसके बाद इसको आप हटा सकते हैं।
एक्यूपंक्चर के साथ साथ उससे जुड़ी कई नई तकनीक से इलाज करने वाले डॉक्टर रमन कपूर सर गंगाराम अस्पताल में एक्यूपंक्चर विभाग के हेड ऑफ डिपार्टमेंट हैं। डॉक्टर कपूर कहते हैं कि इस इलाज से शरीर की इम्यूनिटी यानी प्रतिरोधक क्षमता बढ़ जाती है।
इसमें आजकल एक बहुत अच्छी पद्धति भी एक्यूपंक्चर में यूज करते हैं जिसको हम कैटगट एम्बेडिंग कहते हैं, जिसमें कि एक्यूपंक्चर के पॉइंट पे छाती में सेंटर में एक एक्यूपंक्चर का बिंदु होता है, उसके ऊपर एक कैटगट थ्रेड जो है उसको एम्बेड कर देते हैं और वो 4 से 6 हफ्ते में अपने आप डिजॉल्व हो जाती है। तो ये इलाज बहुत ही पॉपुलर होते जा रहे हैं। ऐसे ही एलर्जीज के लिए ऑटो इम्यूनाइजेशन भी बहुत सक्सेसफुल है, जिसमें कि एक एक्यूपंक्चर पॉइंट से दूसरे एक्यूपंक्चर पॉइंट पे 1 ml ऑफ ब्लड भी जो है वो इंजेक्ट कर देते हैं। इससे भी बॉडी की इम्यूनिटी बढ़ जाती है।
पैच से इलाज का ये तरीका सिर्फ बीमार लोगों के लिए नहीं है। अगर आपको ज्यादा ठंड लगती है तो भी इससे आपको राहत मिलेगी।
तो हम इसको कहते हैं कॉन्स्टिट्यूशनली वीक पेशेंट्स जो कि ठंड बर्दाश्त नहीं कर पाते। ऐसे पेशेंट्स में भी इन पॉइंट्स पे अगर हम ये मॉक्सा पैचेस लगाते हैं तो उससे उनका जो ठंड से बचाव भी हो जाता है और उनके अंदर जो ये पोर्स खुलने से वो ठंड उनको कम लगती है।
दिल्ली से गीतम श्रीवास्तव के साथ ब्यूरो रिपोर्ट, इंडिया न्यूज।
Now I am going to share with you information regarding a very effective tool which is used in acupuncture therapy, which is known as ear acupuncture. This small ear has got over 80 acupuncture points at which needles can be placed, and these are retaining needles. They can stay with the patient for 10 days very comfortably without any problem. And there is a special probe which is used to locate the specific point at which a patient has to be put these needles. Say for example, for patients who have got immune problems or allergies or bronchitis, this is the area which is known as the lung area. So we will press that particular area, and where the patient feels very tenderness or painfulness is the specific point at which we place these needles. As a demo, I will show you the needle being placed at the ear point on the lung zone. And these are very fine Japanese needles which are placed at these ear points, and they can stay comfortably with the patients without causing any problems.
I'm Dr. Ashwini Mehta. I'm a cardiologist at Gangaram Hospital. I would like to narrate my brief interaction with this therapy. I've been suffering from chronic sinusitis for about more than a year, and I had terrible symptoms. Most of the time I used to get headaches and lots of phlegm, especially when I used to get up in the morning, and my nose always used to be stuffed. I tried taking couple of medications with the help of my NT friends. Also underwent one surgery, but slowly and gradually my sinusitis just came back whenever I took treatment. It used to help me just for some time, but it always used to come back. Then I met Dr. Raman Kapoor, and he suggested to undergo this therapy. I was, being a doctor, a little skeptical that whether this therapy really works or not, and whether just putting some pins and needle would make my such a chronic disease go. I was always in doubt. But when the therapy started, slowly and gradually I started to feel better. My symptoms gradually, slowly disappeared. I would just like to highlight that one needs a little patience with this kind of a therapy and give it a time to occur and give it a time to have an effect on the system. That's what had happened with me, and my sinusitis gradually, after 1.5 years of suffering, went away. I thank Dr. Raman Kapoor for blessing me with this. Thank you so much.
Well, I've been suffering from chronic asthma since the age of about 14, which is about 26 years ago. And the biggest problem was that, that whenever I'd have the attack, which is about a chronic attack, I'd have about 2 to 3 times a year, I wouldn't be able to breathe at all, and I'd even been hospitalized 3 or 4 times for it. At one time, I even blacked out and I lost consciousness and then revived about 6 or 7 hours later. And typically, I'd be taking medicine throughout the year. And of course, during those 2 or 3 times of the year, I'd be, taking steroids and other medicines as well. And I had tried homeopathy and Ayurveda, and while perhaps they did have some impact, the impact wasn't so dramatic that I wanted to continue with it. So I just tried for a month or 2 months and then said, okay, forget it, and go back to my allopathic medicine. And what happened was, a colleague of my wife's wife happened to be coming to Dr. Kapoor's clinic for the same problem, and he had benefited a lot. So I began trying it, and I began coming here about 2.5 years ago. And the first time that I came here, I think within a few days of coming here, I happened to have a major asthma attack. And then Dr. Kapoor inserted what is called a catgut out here, which is, this is the place where these are the 2 points which stimulate the lungs. So he put a catgut there, which is like a little, a thread there, which just kept stimulating those lung points. And then I, got off my medicines within about a month of beginning the treatment. I stopped having medicine. So today I don't take any medicines at all. I do come back once in a while to the clinic, for follow-up treatment. So if, during the change of season, or if there's some little problem, I would come back, for a week, or once, in a month, I would come back for a follow-up treatment. But by and large, there's a vast improvement. One point that is worth noting is that, we have 2 big festivals in India. One is Holi and one is Diwali. On Holi, we sprinkle, colors, dry colors and wet colors on each other. And I've never played Holi for the last 25 years because the moment anybody threw color on me, I would just have an asthma attack. Similarly, on Diwali, we burst crackers. So the air is completely polluted and there's no way that you can breathe. I never, celebrated Diwali in any serious manner, again, for the last 25 years, Ever since I've been coming here, the last 2 Diwalis and the last 2 Holis, I've been playing. So